Hi, this is Dr. Kim, and I am an integrative and functional medicine physician with expertise in low-dose naltrexone. And today's topic is long COVID, autoimmune connection symptoms, and how do we treat it with LDN and functional medicine. And I'd like to actually add a little more because this is a bit of um, the challenge I think that we have at post-COVID. So the long COVID is also known as post-acute sequelae of SARS-CoV-2 infection, or PASC, but we just call it long COVID. I think that's unfortunately about 40% of people after COVID-19 with symptoms lasting months or years, they have it, and many patients come to me to find answers or actually to improve their life quality of life. And the emerging research looks like autoimmune mechanisms are at play, and that there are immune modulation therapies like LDN and tools in functional medicine makes perfect sense. And for the record, the people who are committed, I have two healthcare practitioners who are not free of long COVID, but they're functional again. At one time, they were not even functional. So understanding long COVID and then the autoimmune connection, it's kind of interesting because COVID appears to look like a combination of autoimmune disease plus chronic fatigue syndrome plus fibromyalgia plus something more. So one of the things, a lot of things we talk about or think about is persistent inflammation, immune dysregulation, and autoimmune overlap. I think that a lot of common symptoms include severe fatigue or profound fatigue, brain fog, poor concentration, muscle pain, joint pain, and some of the people even have myositis, which is an autoimmune condition, and the sleep is unrefreshing, or insomnia, dizziness, headaches, palpitations, orthostatic intolerance, shortness of breath, and headaches and mood changes and whatnot. So, and in 2023 study, 85% of patients still had symptoms. So, why would we think about LDN? LDN calms neuroinflammation, and that happens through toll-like receptor 4 on microglia being blocked by LDN or low-dose naltrexone, balances immune system overactivity by T regulatory cell enhancement or modulation, and boosts natural endorphins for pain relief and mood support. So there are the studies showing that LDN can improve fatigue, brain fog, and sleep. There's another study that shows the LDN and NAD plus supplementation improved quality of life. And so it makes sense. And functional medicine, I think, is a good, like a marriage to LDN. And I don't want to say that LDN has very high results with helping this condition. In my practice, I like to have tools that can get 80% of the results, and I would say LDN doesn't meet that. What I can say is that I can get that result on a very committed patient, maybe about 70 to 80% of them functional, not cure, functional. And the approach to functional medicine includes gut health restoration, nutrient repletion, mitochondrial support, and in here, actually, methylene blue can be a useful tool for that. And actually, I'll add that because that ethylene blue is the most useful tool that I have in my toolbox for mitochondrial support. I know there are other supplements that they like alpha lipoic acid, acetyl L-carnitine. I just haven't seen consistent results as well as methylene blue. And I want to say that nothing is a 100%, including methylene blue, but it's better than anything I've used. And then, of course, on the nervous system regulation, breath work, meditation, adaptogenic herbs, toxin reduction like mold, heavy metal, liver support. anti-inflammatory diet is another way. I think that LDN and functional medicine is really a match made in heaven and really works well. And that's why I really recommend it to patients. And if you like this video or you have learned something, please give me a like and subscribe and share it. I think there may be other people who can benefit from it. And I do want to mention that I'm on vacation, so I don't have the usual access to my lighting and whatnot. So the quality isn't as good, but I'm trying to keep up with the need and demand of the knowledge base. Thank you so much. I really appreciate it. Have a great day wherever you are.